Hi, my name is Nicole and I'm here with Pamela. We're going to start off this video with a peer interview about common knowledge on coronary heart disease.
Hi, Paul.
Hey, Pam.
So can you start this interview with telling us a little bit about yourself?
I'm 23 years old. I grew up in Miami, Florida. Have parents of Latino background, both Brazilian. I came to Gainesville 3 years ago for school, and here I am.
Yeah, what are you studying?
I studied wildlife ecology and zoology.
Okay. So can you tell us what do you perceive as your greatest health risk at this time?
I don't really have any health risks.
Really?
I don't see any risks.
So do you see yourself as, or does any disease kind of stand out to you as you age?
No, maybe, the random cancer in the family or Alzheimer's when I'm older, but nothing I'm expecting.
Okay. So did you know that 1 in every 4 males die from heart disease in the United States?
No, but I do now.
Okay, well, I'm going to have Nicole take over from here and teach us a little bit about heart disease.
All right, Nicole.
Thank you, Pam and Paul. As previously mentioned, 1 in every 4 males die from heart disease in the United States. Also, between 70 and 89% of sudden cardiac deaths occur in men. In 2014, 24.5% of all deaths in the United States were due to cardiac disease. So your heart is really a muscle. It's located a little to the left of the middle of your chest, and it's about the size of your fist. The heart sends blood around your body, and it provides the body with the oxygen and nutrients it needs. It also carries away waste. Your heart is sort of like a pump, or two pumps in one. The right side of your heart receives blood from the body and pumps it to the lungs. The left side of the heart does the exact opposite. It receives blood from the lungs and pumps it out to the body. You probably guessed that the blood just doesn't slush around your body once it leaves the heart. It moves through many tubes called arteries and veins, which together are called blood vessels. These blood vessels are attached to the heart, and the blood vessels that carry blood away from the heart are called arteries, and the ones that carry blood back to the heart are called veins, which we can see in the picture on the right. The movement of the blood through the heart and around the body is called circulation, and your heart is really good at it. It takes less than 60 seconds to pump blood to every cell in your body. Now that we learned how the heart works, let's now focus on what is coronary heart disease. Let's start by talking about plaque. Plaque is made up of cholesterol, calcium, and fibrin, which are very sticky, and they stick to the walls of the arteries and build up. This decreases the blood flow to the heart and makes it easier for a blockage to occur. When plaque builds up in the arteries, the condition is called atherosclerosis. It is important to note that the buildup of plaque occurs over many years. Over time, plaque can harden or break open. Hardened plaque narrows the coronary arteries and reduces the flow of oxygen-rich blood to the heart. If the plaque ruptures, a blood clot can form on its surface. A large blood clot can mostly or completely block blood flow through a coronary artery. If the flow of oxygen-rich blood to your heart muscle is reduced or blocked, chest pain or a heart attack can occur. Over time, coronary heart disease can weaken the heart muscle and lead to heart failure.
Research has shown that smoking, a fatty diet, which is commonly found in fast food, eating a lot of red meat, high amounts of sugar, and high blood pressure can cause coronary heart disease. About half of all Americans have at least one of these 3 key risk factors. Other risk factors include lack of exercise, diabetes, too much alcohol, and obesity. So let's talk a little bit about symptoms of coronary heart disease. The most common symptom is chest pain or discomfort. Most heart attacks involve discomfort in the center or left side of the chest that often lasts for more than a few minutes or goes away and comes back. Other common signs and symptoms of a heart attack include upper body discomfort in one or both arms, the back, neck, jaw, or upper part of the stomach, shortness of breath, which may occur with or before chest discomfort, nausea, kind of like feeling sick to your stomach, vomiting, lightheadedness or dizziness, fainting, or breaking out in a cold sweat. Sleeping problems have been noted, and tiredness or lack of energy. It is important to note that not everybody shows signs and symptoms and not everybody is the same.
So, how can we prevent or reduce our risk to getting coronary heart disease? We can do this by maintaining a healthy weight, managing stress, regular exercise, which is usually 150 minutes per week, quitting smoking, or never starting. But a lot of people struggle with a heart healthy diet. What exactly does this mean? Well, we can switch to fat free or low fat dairy products such as fat free milk. Also, consuming more of fish high in omega 3 fatty acids such as salmon, tuna, and trout about twice a week. Fruits such as apples, bananas, oranges, pears, and prunes are also great. Legumes such as kidney beans, lentils, chickpeas, black eyed peas, and lima beans. Vegetables such as broccoli, cabbage, and carrots. Remember, the more color variety, the better it is. Whole grains such as oatmeal, brown rice, and corn tortillas. And when following a heart healthy diet, you should avoid eating a lot of red meat, palm and coconut oils, sugary foods and beverages, and also two nutrients in your diet that make your blood cholesterol level rise and you should avoid are saturated fat, which is found mostly in foods that come from animals, and trans fat, which is found in foods with hydrogenated oils and fats, such as baked goods, cookies, cakes, pies, crackers, frosting, and coffee creamers. Some trans fats also occur naturally in animal fats and meats.
So, Paul, what did you take away from this video?
Well, I'm a little more concerned about my heart and my health, so I'm going to try to watch what I eat more and take advantage of the gym membership I have a little more often. And while I'm at it, I should probably schedule an appointment with my doctor, check to make sure my cholesterol is good and blood pressure is good.
Awesome.
Thank you for listening. If you would like more information, please visit the American Heart Association website at www.heart.org.